Gamma knife is a very special tool that's designed specifically to treat brain diseases. The way it does it is to focus 192 tiny little beams of radiation to a tiny little spot. It spares the surrounding normal brain tissue from the radiation. Of course, that would then reduce the risk of side effects from the treatments.
The Gamma knife is very precise, and so we can target very small regions. And because we use a frame-based system, we know that the patient isn't moving around, so we can be very confident about where the radiation is actually going.
Rather than dragging it out for multiple sessions over weeks, it's usually easier for the family to accommodate. It doesn't keep the patient away from their family. They're able to resume their normal activities in a day or two. So there really are a lot of benefits here for not just the patient, but the family.
What happens is that first thing in the morning, our Gamma knife nurse will get the patients ready, start an IV. Then I will come in to put on this thing called a stereotactic frame. The frame will then act as a frame of reference for the computer. The computer then can calculate all the different coordinates in this frame. After the patient is scanned in the MRI scans, information is placed into the computer here, and then the radiation specialist and I will sit down and do the plan on the computer.
We can treat different regions of the brain by moving the patient around in the machine. So it allows us to very quickly treat to higher doses.
Often patients are relieved that there's this other option that can treat this without having to make an incision. And you can do this as an outpatient, so the recovery is much shorter. If you have brain surgery, the recovery is probably going to be 6-8 weeks. With Gamma knife, there's hardly any recovery. I tell patients to take it easy for a couple of days, and that's pretty much it.
Whereas most of the radiation I do, you're sort of hamstrung after doing the first course of radiation, what to do next if there's a recurrence. With the Gamma knife, we have ways to salvage the situation. We will follow them. We have routine clinic visits. We will make sure that they have all the support they need to maintain their quality of life for as long as it can.
I don't like to treat patients in isolation. You know, I value Dr. Mignano's expertise and his knowledge in radiation oncology, and we really complement each other in terms of our understanding of patients' pathology and their diseases.
We get patients from all over. I think it's important for people to know it's here and that we have a great team that works really well together to make sure that people get treated quickly and efficiently and very well.